Hello everyone, I'm Dr. Ramya, VR and Ocular Oncology Fellow from Sankara Eye Hospital Bangalore. Here is what I learned today: the tips in managing SRG removal. The catch point in the removal of the subretinal gliosis is to completely remove all the pre-retinal membrane as meticulously as possible and then only approach for the SRG removal. All SRGs need not to be removed unless it's causing significant tenting of the bricks or submacular or subfoveal causing tenting of the macula or the fovea. The risk versus benefits of SRG removal should be considered before jumping and planning for SRG removal. The peripheral SRGs not causing any significant tenting can be left in situ. The cases deemed necessary for SRG removal, the site of the removal need to be decided upon the line of direction of axis from the port in the dominant hand, and a more peripheral point of axis needs to be considered. Once the site and the location is finalized, then only the different techniques of SRG removal should be considered. The pinch and peel is the most commonly preferred, where the retina is pinched at the summit of the SRG so as to drag it out. In some cases, only the dissection of the SRG bands may itself serve the basic purpose to relieve the tenting. If the SRGs cannot be directly approached, then a small planned retinotomy is required. The removal of the SRGs can be done using a various techniques like the spaghetti and the meatball technique, in which the SRG is held and the forceps are rotated to roll the SRG on the forceps so as to help its removal with uniform and persistent traction. The counter traction techniques, where the SRG is held with the forceps and the removal is aided with the shaft of the light pipe used as a fulcrum to redirect the force of the SRG removal, directly rubbing on the edge of the retinotomy and causing it to tear and enlarge. And in bimanual technique of hand on hand, using a chandelier light and the two forceps and removing the SRG by holding and reholding the SRG with another forceps for better holding and removal with minimal trauma to the edges of the retinotomy. The last technique is transscleral or transconjunctival removal is a very technically challenging procedure in which the SRG is removed by making a scleral ports at the site of the very posterior SRG and then the removal. And some SRGs are in sheets, those would require a large retinotomy or retinectomy for its removal. Thank you.